Hello, my name is Mohammad Ghaznavi and I'm one of the interrogated for today's session. With us is Dr. Haris, right?
Yeah.
So we are going to do this card from OET-Medicine right now. This is a breaking bad news type of scenario. So most of the people are having difficulty in doing breaking bad news. So we'll try to simulate this scenario for you. We'll do this card and after that there will be a live feedback in this session so that you will have an idea as well for the breaking bad news, and for those people who had joined us online, they would have an idea, and those people who even have not joined but they are preparing themselves for OET, they can take a lesson online for free from the YouTube channel, right? Anyhow, First of all, we have a warm-up session. I'm going to ask you some question, right, for that. Hello.
Hello, sir.
How are you?
I'm good. How are you?
I'm fine. Where are you from?
I'm from Islamabad.
So can you tell me about yourself?
My name is Haris, and by profession I'm a doctor, and my hobbies are playing basketball and going for photo shoots and modeling as well.
Photo shoots and modeling. So don't you think there is a contrast in doctor and being a model?
But when you're doing MBBS, right, you get there's a lot of boredom. So to kill that, so you need a side hobby or a job to
So you love
feel better.
being a doctor or being a model?
Being a doctor, is basically a profession. Modeling is temporary.
Oh, yeah. That's fine. So you have the card. If you have received the card, please. So you have 2 minutes time to prepare this card.
Okay.
Okay, and after 2 minutes we will start. Then we will be having 5 to 6 minutes time for counseling.
Okay.
You can take your time.
Hello, Mr. Mark. My name is Dr. Haris, and welcome back to the clinic. And we had your results a week ago. So with a very heavy heart, I have to let you know that you have, due to rectal bleeding and the colonoscopy, you have a tumor.
A tumor?
Yes.
Oh my gosh, doctor, how it can be tumor? I don't believe that. It might not be my report. You just ruined my day, doctor. Like, I'm just, oh my gosh. My daughter has a birthday in 3 days and you're telling me it's, oh.
But you do not have to really stress about it, because there are a lot of treatments now.
You're right, but how it can be?
A tumor in the
Why
descending,
me, doctor?
Basically, tumor in the descending column is what your biopsy has confirmed us, that there is a tumor, but it's not that large. It's just 2 centimeter large, and I would say if you get it operated, you'll be absolutely good to go.
What difference it will make, even if it's 2 centimeter or what, doctor? It's still a cancer.
But rather than just staying this way and by losing your life, once you have a chance to save yourself, why not take that?
Okay, can you tell me about the management then, doctor?
Yeah, I would let you know that there's this surgery that includes chemo and radiotherapy, and after the surgery, and the surgery, basically your tumor, they're gonna remove that tumor and you will be like all good to go again. And
but doctor, as you mentioned the chemo radiotherapy, I heard the name, so I don't want this chemo radiotherapy, please.
You can take your time, deciding whether.
I'm not ready for that, to be honest with you.
That's absolutely, fine. You can, take your time after the surgery, and we can discuss again after a few weeks. If you want to get it, you can research about it yourself. And if you're,
you know what, I'm not ready for that. I saw people suffering from like chemo radiotherapy, and
yeah.
Oh my gosh.
What, we can, meet after 2 weeks again and then talk about it.
We'll see, doc, but my aunt died of bowel cancer.
Yeah.
I still remember her time, she used to have chemo therapy session. It was quite, difficult time for our family and for her as well. I still remember the pain on her face.
Yeah.
So I don't want to go for chemo therapy at any cost. I just better to go for the surgery, and I don't want that, like the chemotherapy thing.
Let's first go for the surgery and then we'll decide onwards what chemo, etc.
Okay. But if you can write in the referral to the surgeon that please do not nominate me for the chemotherapy surgery. I don't want that. I just want it to be clear. If you can write in the referral, please.
I think, I would like to write that the surgeon can decide after the surgery that what's best for you.
Okay, I appreciate that. I appreciate that. And how about this tool collection bag? People do have that bag, after surgery. Do I need that one?
Basically, colostomy bag is not needed since your tumor is confined to the lower part of the large intestine, so that will be not needed at all.
Oh, that's great. And how
Yes.
about how optimistic you are for surgery? Are you sure they are gonna cure, like have a proper cure for
Well,
this?
I have a good news for you. The
that's
success
great.
rate is very high for this surgery. So you'll have a successful surgery, and and since your tumor is limited to the bowel movement, bowel wall. So it'll easily get it'll easily get removed, and you'll be living a normal life.
Okay.
Really soon.
Okay.
And then you can have fun with your family. And
Oh,
your
that's
daughter.
great. I'm really thankful that I had such good news at the end of the day.
Yeah.
Yeah. Thank you very much for doctor for your time.
Thank you so much for visiting, and and I wish you the best of luck for your surgery, and looking forward seeing you all healthy again.
Thank you, doctor.
Thank you so much.
Okay. So this was the card. We have discussed about the breaking bad news. We discussed that what kind of mistakes normally doctors can make when they do the breaking bad news. The common mistake in the breaking bad news is always a false start, as most of the people, they just memorize the start and they try to implement the start over here. Even some of the candidates, they would be able to start it appropriately with the tagging question, but their tone is not supporting the scenario. This is a breaking bad news, and you are going to diagnose a patient with a cancer, though it's in the initial phase, but still you must have the like polite tone, and it must be declining. You must have a descending tone toward the diagnosis till the time you diagnose it. Then you have to ascend, because these are good news that's treatable. Secondly, there are the stages of disclosure. Like you have to take first step with the tagging, that is followed by the background. You have to make a background statement, whatever has been given in the card, that there was a history of bleeding from the back and so on. Then you have to explore the patient past experiences, patient expectation, for example, and if patient would like to call someone. These are some of the mistakes people are doing, but most important thing is your background statement, stages of the disclosure, and the tone. So I hope if you still have any question, I hope this was an interesting session for you. Yes. So if you still have any question, you can ask us. So those students who joined us online, you can also make a comment over there, and those who even had not joined us, you can watch this video and you can ask a question. We'll try to answer you as much early as we can. Thank you.
Hello everyone, this is Dr. Haris, and today I'm here at the M&M Institute. Basically, my speaking session was, really good here, and I learned a lot. And M&M Institute is just not a place where you get to, give mock tests and all that. Here, you get to learn a lot and, get a good grade. So what are you waiting for? Join now.